Hey everybody, my name is Mrs. Iverson. I am here with Mrs. McFeeters. We are going to teach you how to do a HEENT assessment today. So head, eyes, ears, nose, and throat. So the first thing that we're going to start with is we're going to inspect for symmetry of the face. So what we're looking for is facial drooping. So we're looking at the face, and if I drew a line down the middle of her face, both sides should look symmetrical. The next I'm going to do palpation. So what I'm palpating is the frontal and the maxillary sinuses. And what we would want is that there's no tenderness upon palpation for that. And then I'm gonna palpate again, but I'm palpating for lymph nodes. So we're gonna start here in front of the ears for preauricular, postauricular, and then there's tonsillar, just below the ears, kind of starting on the neck. Occipital is back here on the back of the head, and then I'm coming down to submandibular, which is underneath of the jawline. Submental is under the chin. Moving down to the neck, there's two chains here in the neck, so we're looking at the interior cervical chain and the posterior cervical chain. They kind of make a triangle shape in the neck. And then I'm coming into the supraclavicular, which are the lymph nodes that are inside of your clavicle. If you have a hard time feeling those, you can have them shrug their shoulders and dig your fingers in to feel for supraclavicular lymph nodes. Next, we're moving into our eye assessment. So I would take my patient over to the Snellen eye chart, have her stand 20 feet away from there, and then I would have her read the smallest line. So I have one here to show you. This is what we're looking at. You'd have your patient close their right eye, read the smallest line they could, do their left eye, and then you could do both eyes. What matters most for validation is that you're able to tell us what the numbers mean. So at 20/20, that's perfect vision. So at 20 feet, your patient can see what other patients can see at 20 feet with perfect vision. With 20/30, you're saying at 20 feet, my patient can see what someone with perfect vision can see at 30 feet. After the Snellen chart, then we will be inspecting the eyes. So I'm looking at the conjunctiva and the sclera. I'm looking for redness, I'm looking for drainage, I'm looking for any sort of swelling. I'm gonna have my patient pull down their lower eyelids, and that's where I'm gonna be able to see that conjunctiva well. And then I'm going to assess for PEARLA. So PEARLA is looking at the pupils. I'm gonna have my pen light, and I like to put my hand up at their nose. I'm gonna have her look at me, look at my nose here. I'm gonna shine my light at the pupil. I'm watching for not only the left pupil to react to the light, but then I'm going to make sure that the right eye is also moving at the same speed. That brisk would be our normal, what we want, that our eyes are moving in the same manner. If they're not, then you have unequal pupils. One pupil would be fixed, one pupil would be brisk, or however you're gonna evaluate that based on patient by patient situation. And then I'm going to look at the ears, just inspecting the ears, external ear with my pen light, looking for redness and drainage. So I'm gonna take my pen light, shine it on the left ear. I don't see any redness or drainage coming from the external ear. And I'm gonna look at the right ear, and I'm gonna do the same thing. And then I'm going to perform the whisper test. So I'm just gonna take a 2-syllable word, I'm gonna whisper it to the patient, a different set in each ear, and then make sure that the patient can hear what I'm saying.
Hot dog. Half nap.
Perfect. So she accurately repeated what I whispered, so she passed the whisper test. Then we're gonna inspect the nares. So we're looking at the nose. We're gonna inspect each nair for symmetry, make sure that they are symmetrical bilaterally. We're looking for redness, we're looking for rhinitis or drainage, we're looking for any bleeding, and we're using the pen light to do that. Bleeding is also called epistaxis, which you'll see on the rubric. Then we're gonna inspect the mouth. which we're gonna have our patient say, ah. We're using our pen light. We're looking at the mucous membranes. We're looking at the tongue. We're also looking at the gums. So you can have your patient pull their bottom lip down. I'm looking to make sure that the gums are all intact. There's no bleeding. You want to note if there's any missing teeth or cavities and like that. Last thing, you're going to have them say ah really loud, and you're looking at the back of their throat for their uvula. You're making sure that the uvula is symmetrical. You're also looking for any redness in the back of their throat. And then you're going to do your last 5. So you're going to perform your last 5, and then this assessment is all done.